talking about that route later in the show. Now, have you got, or have you had, a relative, a loved one, perhaps you've been in hospital, and they invoked the COVID rules yet again when it came to visiting? Good work by one of the newspapers today, the Daily Telegraph. They've done some analysis of this, and they've shown that hospital patients are being denied visits from loved ones by trusts using outdated COVID restrictions. The paper points out that the NHS told hospitals to open up in March of last year, so that's 10 months. Despite that, 70% of trusts still have some form of visiting restriction in place. A majority of hospitals are still not allowing more than 2 visitors at a time. I thought that was in some hospitals prior to COVID, wasn't it? I'm sure there was a number. I mean, I don't know that it was as brutal as 2, but I'm sure there were restrictions. I'm sure I've visited people in the past and I've had to wait outside because, others have been there and I take my turn. Anyway, some patients are only able to see friends and family for 1 hour a day. Others are prevented from close contact. In inpatient wards, accident and emergency departments, outpatient clinics and maternity wards, there have been instances where families are being restricted from seeing their relatives. Health Secretary Steve Barclay is resisting setting any national diktats on visiting rules, despite calls from patient campaigners. Why? And this comes as... here's some good news. We like to try and bring you good news. This comes as COVID wanes across the country. Infections down by a third in a week up to Jan the 20th. When was that? I see. OK, the end of last week. All right, so let's go back to when this was necessary. April 2020. Less than a month after the country went into lockdown, March 23rd, of course, of that year. Then Health Secretary Matt Hancock, what happened to him, announced the very strictest COVID-19 legislation would be relaxed to allow close members to see dying relatives to say goodbye in hospital.
Wanting to be with someone you love at the end of their life is one of the deepest human instincts, and it's a moment that will be with you forever. Coronavirus, of course, has made this much more difficult, and I've been really moved and upset by some of the heartbreaking stories of people dying without a loved one nearby. So I'm pleased to say that working with Public Health England, the care sector and many others, we're introducing new procedures so we can limit the risk of infection while wherever possible giving people's closest loved ones the chance to say goodbye.
Matt Hancock, what have you encountered, whether it's trying to visit someone who's in a hospital in the name of COVID, or, as we said, a maternity unit, an outpatient unit, A&E, restrictions? As I've told you many times, I'm sorry to keep labouring the point, but it is very pertinent to our conversations. I was in an A&E with one of my sons I'm just trying to remember. It was in December. No, they weren't wearing masks. I was trying to remember whether we were all required to wear masks. I recall that some people wore masks, and I noticed that all the doctors, well, I assume they were doctors, junior doctors, I don't know, the medical staff, they all seem to be wearing masks. So what have you encountered? And have you been denied getting to see mum or whoever it might be, your husband, in a hospital? We'll take your calls in a moment. Let's talk first to someone who's actually features in the Telegraph coverage of this. Julia Jones is co-founder of John's Campaign. Can I ask you first off, if you don't mind, just explain what John's Campaign is? Good morning.
Good morning, Nick. Yes, John's Campaign fights for the right, particularly of people with dementia, to be supported by a family carer when they're in hospital, and for the family carer to have the right to support that person. But there is a wonderful saying, get it right for dementia and you'll get it right for everybody, because many of us are at our most vulnerable when we're in hospital. Cool. And we need somebody to support us, reassure us and advocate for us. And that's why John's Campaign has in the 8 years we've been running, has reached out beyond dementia to advocate for the rights of everybody to have somebody. And that's why we're absolutely behind Ruth May, and we can't understand why the Secretary of State isn't supporting his own chief nurse.
Ruth May, the chief nurse, of course. So what the chief nursing officer, just to get her title absolutely right. So what is it some of your members are telling you? What are the problems that they've been encountering trying to get to see loved ones or friends, Julia?
Well, I mean, you played that quite moving clip from Matt Hancock from April 2020. Well, after the Telegraph article went online this morning, somebody sent me an email timed at 1:30 this morning saying that her family are facing a coroner's hearing in a couple of weeks' time, where they are saying that they were denied all access to their mother with dementia. And they feel, and the coroner feels as a case to answer, that this contributed to her death. And this is really, I can't stress, Nick, how serious it is. It's not just, the sort of, kisses and chocolates. It's actually people's well-being and their best chance of survival. She's not the only one. I'm really alarmed now, at the number of people who are now giving up on the hospital complaint system, giving up on the health service ombudsman, and asking the coroners to rule. And because this isn't the first one where people have gone to a coroner's court saying, we believe that denial of access to our vulnerable mother or husband or father or dearest friend contributed to their death.
You mentioned, I think, chocolates. What is it then? It's not just grapes and flowers and chocolates. And why is it so important to people with the condition that they see their sons, their daughters, whatever it might be?
Well, I think in our campaign, we do, to some extent, differentiate between carers and visitors. And with carers, we point out that a loving relationship, supportive relationship, contributes to the best outcomes for patients, because somebody knows somebody's past history, their needs, their weaknesses, their fears. They should be seen as part of the patient's team. And I'm really angry, Nick, with Steve Barclay, because he's letting down the NHS constitution. This is our NHS. It's not. There's a really awful quote in he wants the staff on the front line to make decisions about visiting rules in their own hospitals. No, it's not their hospitals. It's our hospitals. This is for us.
Well said. Well said. Do you think there should lastly be, excuse me, do you think lastly there should be some national statement from Steve Barclay that, right, as of the end of this month, every hospital, unless, of course, there's a sudden outbreak of COVID, every hospital reverts to allowing patients to visit. People to visit patients, I'm sorry.
No, I think more than that, Nick. I think it should be a right attached to every citizen of our country that if you're in a mental health unit, a hospital, or a care home, and you're in need, you should have a right to a care supporter, and it should be a legal right not to be mucked about with.
Grateful to you for that, Julia Jones, your co-founder of John's Campaign. Thank you. This research by the newspaper comes after a recent report by the CQC, which, of course, reminds you is the Care Quality Commission, found more than half of pregnant women were denied their partner's support during birth last year, despite the end of COVID restrictions. So if you'll allow that in most instances, I know you can get early onset dementia, but in most instances, dementia comes to you later in life. We are effectively managing now to rule out both ends of the age scale, aren't we? We're having the baby who dad can't be